If you look around, you'll see the world can be pretty smart. Okay, very smart. At Capella University, we think education should be smart too. That's why we're reshaping online learning with our FlexPath format. You can set your own deadlines, take classes at your own pace, even leverage your previous experience to move faster. So when it comes to earning your bachelor's degree, you know what kind of choice to make. A smart one. Visit capella.edu to learn more. Capella University. Don't just learn smarter.
Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am here with Dr. Millicent Ravello, who is really excited to talk about liposuction of the calves and ankles, a.k.a. Cankles.
The Cankles. It's not a huge topic because it's...
Oh, it can be.
But it can be because if you have Cankles, it is a huge problem.
It's an issue.
It is huge because, that's the one part of your body that you probably show off on a regular basis. And it's not like, your tummy or your breasts or anything else that can be sort of camouflaged. If you have fatty ankles, Cankles, calf ankles, everyone sees them. They're kind of hard to hide.
They are hard to hide, and I don't know of an exercise you can do to get rid of Cankles.
You can't. It's
not like weight loss is going to do it.
It's not. So Cankles can be from usually a couple of different reasons. Some people just have thicker bones in that region, or the curvature of the bones is a little more bowed at the ankle level. So it sort of gives the appearance of a thicker, wider ankle. But in general, someone that's really concerned about the size of their ankles, it's because there's actual fatty deposits. And no matter how much weight you may lose, you're probably not going to lose it from your ankles.
For sure. It is fat. And
it's fat.
Weird how much fat can be there.
There can be a lot of fat.
This fascinated me so much that I have written a paper about liposuction of the Cankles.
And what did you learn in your paper?
Well, we wrote about doing it under tourniquet.
Okay.
And I'll tell you why. Because we thought that if you had to tumesce like crazy, that getting the artistry of what you wanted for the cankle was going to be difficult. So we would exsanguinate the leg and do it under tourniquet. We would still do tumescent because we thought that tumescent would be important for bruising and postoperative pain control. But we would not do like a super wet or tumescent technique. It was more like a wet technique.
Okay.
And what we're talking about is how much fluid you pump into the area you're liposuctioning before you liposuction it.
Yeah, typically it's for bleeding and for postoperative pain control, but it can be a lot. And it's certainly in the area that's so small and, definite as the ankles, it could disfigure. Okay, all right, so what did you figure out?
So, well, let's backtrack and go back to the square one is, what is the treatment for Cankles? It is liposuction.
It's liposuction.
We've talked about
Spoiler alert, it's liposuction.
Yeah. We love liposuction for Cankles. There's no excisions to do. There's no weight loss method or,
bone
shrink
shaving.
ray.
No.
So it is liposuction. And how you do it and how you get it done is really important. The candidates for calf and ankle lipo are pretty much somebody who's not happy with the contour of their lower legs. And they are healthy enough to undergo surgery.
And they actually have fat there.
Yeah, and shocking how much fat there is. You think you're going to go in there and suck out, 50, 60 cc's. It's 200 cc's of fat.
Which is a lot.
Which is a lot.
That's a lot.
In an area that you would think there's just not a whole lot of room to have that happening. But there certainly is. And we found that under tourniquet control, you could really get nice contours. It's not necessary. I don't think... I'd still do it if I really think it's going to be a hard operation, in that getting like that the leg is just like a tube, and that I'm not going to be able to tell how much to take out to get the contour. If I tumesce it too much, then I'll do the tourniquet control. But if I can tell what needs to be done, in other words, in the preoperative assessment, I typically what I do is I take 60 cc syringes and I kind of hold it near the fat. I'm like, oh, that looks like it's going to be at about 120 or 180 cc's and I need this much from here. And I can mark it. Then I know what I need to get out. I don't have to use tourniquet control. But there are some patients where it just goes from the knee to the foot and it is like a tree trunk.
One straight leg, yeah.
And I don't know how you're going to contour that if it becomes